Welcome to our podcast, Advancing Health Equity Through Advocacy, Student Nurse Edition, where student nurse scholars are advancing health equity through the art of advocacy. As students and new nurses, advocating for patients and yourself can be difficult. Through this podcast series, our nursing student scholars will introduce you to experts and advocates in the field of nursing that can help highlight ways that you can make an impact on our maternal health crisis and on the health of the communities we serve.
Hi, everyone, and welcome to our podcast. I am your host, Alysa Meza, a BASS Scholars Student Nurse at the UTMB School of Nursing. On this episode, we will be discussing nurse advocacy in the correctional healthcare system and the nursing impact. Today, we are joined by our guest, Dr. Patricia Blair. Dr. Blair, thank you so much for joining us.
Thank you for having me.
All right, to get started today, can you tell us a little bit about yourself and the work that you are currently doing in the advocacy space of nursing?
I am a nurse who's also an attorney, and I am very interested in advocacy for our patients. I have done work in corrections for a very long time and am now trying to pull together a team here in Texas to take care of the health inequities in corrections.
Thank you for all the work that you're doing, and thank you for taking the time to be here with us today. So let's dive into our first question. First off, for those who may not be familiar with it, can you describe the opportunities that exist in correctional healthcare for nurses and what type of prior experience is required?
Thank you for that question. The opportunities in correctional healthcare are many. They're very similar to what is found in what we call the free world. However, the experiences that nurses need to come with are varied. The level of health inequities in this population are huge. And so if you are considering correctional nursing, this is the place for you. One of the issues that you will not find on the free world side is the security level that is required for safety of patients and healthcare providers.
Perfect. And that kind of goes into our next question. So as a nurse attorney and as a certified correctional health professional registered nurse, what are the greatest challenges that nurses face when caring for incarcerated patients?
The greatest challenges that correctional nurses face are ethical issues of privacy and confidentiality, because these patients must be accompanied by security, and security are not bound by the same confidentiality rules that nurses are. And so that is a big challenge. How much do you say to the patient in front of security, and when do you ask them to leave the room for a moment?
That's true. I never thought about that. And so I know that there's another term that you're trying to promote instead of incarcerated patients. Can you tell us a little bit about that?
Yes, thank you for that question. We are trying to be more humanistic with this population. They do come from an underserved population, and they are not well respected, even on the free world side. So to become more humanistic, we are calling patients that we come in contact with justice-involved patients, meaning that they're in the correctional setting, but we're trying to make it more humanistic where they feel more comfortable with what we as healthcare providers are doing.
Yes, and I think that's very important work. So again, I know we talked a little bit about some of the challenges that nurses face, but can you kind of go into more depth about the ethical and policy issues that are uniquely related to nursing practice for nurses who work in correctional healthcare?
Yes. We have the Code of Ethics for Nurses, and we have the Nursing Practice Act, and we must adhere to them regardless of the setting that we practice in. Sometimes it's hard for nurses in these correctional settings to adhere to these because of the overlying security issues. We, however, must always keep that in the forefront, and if there are issues, we must look at the policies and make changes where necessary. That does require that we get all stakeholders involved and committed to those changes. It just makes it all better for everyone.
And so with that being said, what are some of the key initiatives or policies that nurses can get involved with as it relates to correctional health care or the policies that inform it?
I think this is where students and new nurses would really thrive in correctional health, because you come out of school with all of these great ideas and you're working with nurses who have been in the field. And so coming in with things like medication administration, how do we do it? How do we do it with a population that is mostly behind bars? We cannot treat them as though they were at their home setting, but how can we make the policies change in order to make the justice-involved individual more committed to their healthcare conditions? And so that's one of the issues. The other is, how do you do your nursing in a confined space, and what kind of educational things do you say to them? Because that's the underlying issue that we have in our schools of nursing, especially for our baccalaureate prepared nurses. Education is extremely important. This group is underserved, and their educational level generally is at the 6th grade level. So how do we improve their health literacy with the knowledge that we have gained in schools of nursing?
Of course. And I feel like being involved with BASS kind of gave us a unique perspective on how difficult it can be to care for patients who are justice involved. So thank you for that.
You're welcome.
And so, of course, I'm sure you know it can be overwhelming for new nurses to know how and where to even get involved. What suggestions do you have for nurses who want to become involved in informing health policy as it relates to correctional health care and the quality of care that justice-involved patients receive?
I think that student nurses and new nurses should seek out opportunities to work in correctional healthcare settings. I think that is the way to get over your fear of what this patient population is, and to look at what and how nursing care is administered in these settings. You come with great ideas. I like listening to those ideas and putting students in places where they can actually spread their wings a little before they graduate. And for those who are new, hopefully you're finding nurses who are aware of that as well. We're having great opportunities at UTMB with our students who go to correctional, especially to Hospital Galveston, into the Carol S. Young unit, because the nurses that we find there are very interested in having our students. And so they're willing to do what they need to do to help you feel comfortable, spread your wings, and be ready to fly when you get that degree.
That's true. I actually went to Carol Young, and I also went to Hospital Galveston during my clinical rotations. And not only the nurses, but the patients are very willing to lend themselves to you to help you learn. And it's a great experience for new nurses, student nurses, to gain experience, not only hands-on experience, but that social aspect of healthcare that seems like it's kind of lacking nowadays.
And that's true. You know, the students are saying that these patients are much more respectful of them than patients in other settings.
Yeah, that's true. I can second that for sure. So with that being said, can you share with us any specific policy initiatives you have worked on in collaboration with the correctional system leadership, and how you believe the nursing perspective enriched the narrative or the outcome?
I have been working with top leadership because in corrections, even though you're talking with the nurses on the units or in the clinics, they are not the ones who can make the decisions. We do have two very large stakeholders in this setting. That's on the Texas Department of Criminal Justice side, as well as the correctional managed care side. At UTMB, we're contract workers in TDCJ. And so we have to make sure that we have clear communication. And so what we've looked at is to determine what are the prevalent conditions that we really want to focus on, and are the policies in line with those changes that we want to make. For example, we're looking at the medication administration. We have a nursing shortage, if you want to call it that, after all these decades. Mm-hmm. But do we necessarily have to personally administer medications to patients? Can we do the teaching, the teach back in the S-bar with them and give them the responsibility for their health care and just monitor them like we would on the outside? Because most justice-involved patients will return to the community. We need them to go back with at least a higher level of health literacy. We have this opportunity, and I think we should take advantage of it. The administrators on both sides of this issue have said yes. And so we're looking at what's called Keep on Person, or short COP, which is probably not a good analogy, but it's there. And so we are looking at having more of the justice-involved patients keep the medications on themselves and then just report to the nurses. That will cut down on the amount of time that nurses are having to do medication administration. That's one big policy. The other is continuing nursing education with nurses who are working very diligently in these settings and cannot get away because of the shortage. And so we're looking at bringing the continuing nursing education to them, along with other issues such as having maybe a conference on the UTMB campus in the future.
It's so great that you're here with us today, because it's important for nurses, for new nurses, for nursing students to be aware of these things so that they can do their part in teaching these patients when they go in there, even if it's just, you're a student nurse in your orange scrubs like we are here at UTMB, but you're still taking the time to teach that patient, even if it's something small about their medication. And I love that you're talking about medication administration, because that seems like such an easy thing. You just scan it, pop it out, hand them their pill, but it's so much more than that. Are we actually getting those two patient identifiers? Are we actually telling them what this pill even does for them? It's such a small thing, but it's actually such a big thing in the grand scheme of things.
And that's true. And remember, earlier we talked about what are some of the ethical issues related to correctional nursing. Mm-hmm. If we're allowing the patients to keep their medication on them, then you cut down on the amount of security you need with them, which is a big problem because they have a shortage as well. Mm-hmm. Nurses can do what nurses are meant to do. Medication administration is one part of what we do, but it's not all of what we do. And if we take all of our time doing medication administration, we're not doing what we're supposed to do mm-hmm. in nursing, in correctional healthcare settings. Mm-hmm. And so it frees us up to do other things, including getting those continuing nursing education credits that we need.
Absolutely. So, as we reach the end, I would really like for the listeners to hear from you about what motivates you to continue pursuing your passions in correctional healthcare nursing, health policy, and the nursing advocacy space. And do you have any tips for new nurses to translate their motivations into their practice?
I'll start with the last one, because I tell my students, regardless of the level that I'm teaching, whether it's undergraduate or the graduate level, be bold. Let your voice come out, because if you don't, you never know if you could have made a difference. And so be bold. Let your voice come out. That is my number one mantra going forward. And so what keeps me motivated is the enthusiasm I see in the students that I have taught. And they have all these great ideas. And I'm not sure that we always know what our students think. And I think if we ask them, then we're going to move much further in nursing, much faster. And so I'm looking for the new nurses, you guys, mm-hmm. and the ones who are out there already to actually commit to what nursing should be and look at what's working, what's not working. And my passion in that is once you see what's working, you keep what's working. If it's not working, what policy can you make, and who are your stakeholders, and are you ignoring some to get to others? And so you want to, do that, because policy is not alone. You cannot do it by yourself. You've got to have people, and you've got to have people who are committed to what you're committed to in order to make the changes. And so I will stay passionate in correctional health care because, one, it is an area where my PhD in health disparities come to play. And so it makes me feel good that I could go back to my own mentor and say, hey, you know that degree that you helped me get? I'm actually using it in correctional health care. The other thing is that as nurses, we have always waited for someone else to tell us what is wrong and how to fix it. That has not happened. So we have got to look inward into the profession, into ourselves, make those assessments for ourselves, and decide where we're going. What's the trajectory? How do we get there? And who are the people that can help us get there? We will be hearing naysayers, but you cannot let that stop you. So if you've got a passion, it will not matter to you how many no's you get. You just keep moving on, and eventually you're going to find someone who will say, yes, let's move it. And so don't give up. That's another thing. I rarely give up if I'm passionate about something.
And so as we close, I know we just heard your passion and your reason and your why behind what you do. And I know this speaks a lot to the nursing voice, the voice of the nursing profession as a whole. So how can new nurses in today's society be leaders in the space of advocacy, policy, and caring for vulnerable populations such as justice-involved people? How can we be leaders?
I always tell students, because you have a certain fear about going into something that you've never done before, but you're prepared for it because we prepared you. And so my thing to all of my students, especially the undergraduate students, find someone who really is concerned about you as a nurse getting ahead and staying in this profession. You will know who that person is, and you just cling to them, and they will, if they are meant for you, they will help you get through. And so my thing is to treat the students that I come into contact with as colleagues, rather than I know more than you, which probably I do, but that's not the point. The point is what I know I will share, and you need to find that similar person out there. If that person is really committed to nursing, they will already be working toward policy changes, and you will just hang on to their coats. We need you. We need you because as we move on, we've got to have someone who continues to sustain nursing and take it to the next level. So advocacy is always about the patient. It's always about patient safety. And you do that when you improve yourselves. And so improve yourself. If you've done that, patient safety will follow. If you're looking at the outcomes, policy will follow, because nothing exists in a vacuum. And you can do it. You've gotten this far. You can make it. We need you. And if necessary, reach back to any of us at the School of Nursing. We really appreciate and are very proud of the student graduates that we have from UTMB.
Perfect. I love that. We need you, loud and proud. Well, thank you, Dr. Blair, so much for sharing your thoughts and your ideas related to this crucial topic of nurse advocacy and the correctional healthcare system and the nursing impact. We appreciate you sharing your time and your expertise with us, and we hope this inspires nurses and future nurses to find their space in advocacy. For all of our listeners, please join us for our next episode, Nursing Students Diving into Advocacy, Reflections of Lessons Learned, as we, the 2022 and 2023 Bass Scholars students, explore lessons learned through an undergraduate nursing health equity scholars program.
Until next time, remember, you too can have a seat at the table and be the voice of change for mothers, babies, and our community now. The views and opinions expressed on our podcast are not necessarily the views of the University of Texas Medical Branch at Galveston Health System or the UTMB School of Nursing.